My name is Kate Higgins. I am a graduate student at Forest Institute. I'm finishing up my schooling there. I want to start by saying that I am by no stretch an expert in concussions. I've had a practicum rotation in concussions, and it's my research interest, so I've done a lot of reading in the area. But I am by no stretch an expert. The things that I'm going to present today are indicative of the places that I've trained and the people that I've trained with. There are lots of opinions in the field of concussion management. So what I'll present today is, again, what I was trained in, what I think the research is supporting, but you may hear other things if you take your child to a doctor or you're talking to an athletic trainer about how to manage concussions. All right, so the things we're going to talk about today, we're going to talk about some statistics regarding concussions. We're going to talk about symptoms that you might see in a child who has had a concussion. We're going to talk about some options for diagnosing a concussion, management of concussion, the myths surrounding concussion, which there are a fair number of. We're going to talk about the psychological implications of a concussion. I have a little audience participation spot, and then I have some resources that I'm going to provide for parents or people who are working with young kids who may have a concussion. I also want to specify the title of today's presentation is Concussion Management in School-Age Athletes. Obviously, that gives us a pretty big span. Most of the research that is on kids under 18 is done on high school students. How well that applies to kids who are, say, 12, 13, is not real clear. There's just not a lot of research on this age group, so we do the best we can to sort of extrapolate what we know about, say, high school athletes down to kids who are younger. But there's just a lot more research that needs to be done on how you manage a 10-year-old who's had a concussion in Pee Wee football. So these are some concussion symptoms. This is not an exhaustive list, but these are some of the main ones that you will most likely see over and over if you're working with athletes who've had a concussion. Sometimes these look a little bit different in kids. For example, the changes in personality. For a teenager, that may mean that they become more emotional. For a 9 or 10-year-old, that may mean that they're crabby all of a sudden when normally they're a pretty happy kid. Some of these symptoms will be a lot more obvious to parents. For example, something that I heard parents of a concussed athlete say over and over is, my kid asked me the same question 3 times, and that just really is not like them. The kid has no recollection of this. So we're going to talk about diagnosis in a minute, but that's an example of why getting parental input as to how the kid is acting, how they've changed is really important, because the athlete may not be aware that they're acting differently sometimes. Is there something I can do to make it not time out? So some of the other symptoms, disorientation and confusion. Lots of times they'll see that on the sideline. A kid comes out of a play and doesn't know what he's supposed to be doing next, or he can't remember the play that just happened. I have my list here, I guess. Sometimes kids will have visual disturbances where they'll have difficulty seeing, or they'll go to school the next day and they suddenly have a difficult time seeing the board. We obviously want to make sure that their eyes are working okay, but that's a symptom that sometimes is overlooked as related to concussion. Headaches, nausea, vomiting, those are some of the more common or more known symptoms of a concussion. Changes in sleep can be a big deal. Kids who have had a concussion may either sleep a lot or they may not sleep at all. If you're not sleeping at all, that can be problematic because sleep is how you heal from a concussion, so if you're not sleeping, that can make it difficult. Impaired concentration is something that we see lots of times in high school athletes. They'll go back to difficult math class and just really have a hard time tracking a lecture when normally that isn't an issue for them. We're going to talk about academic accommodations a little bit later on, and that can be really important to helping particularly high school students who have a more difficult academic load. I realized that I skipped a slide. Yeah. So statistics. Depending on where you pull your statistics from, they look a little bit different. So these are the most recent ones that I was able to find. They're saying 1.6 to 3.8 sports-related concussions per year. That's in the United States, all ages. So all the way from 5-year-olds. Hopefully we don't have a whole lot of 5-year-olds getting sports-related concussions, but all the way up through the pros. I was surprised to find this statistic when I was reading through some stuff for this presentation, that there are 900 sports-related TBI or traumatic brain injury deaths per year. Hearing somebody die from a concussion is pretty uncommon. I didn't realize that it was that high, but I do know. In high school athletes, I found some research that broke down. So for example, 33.09 football concussions per 1,000 athlete exposures. So that includes games, practices, training in the weight room where they, fall into a weight rack and give themselves a concussion. Male and female soccer is also a very high one. Female soccer actually has a higher rate of concussion than male soccer players. Cheerleading is one of the lowest, and volleyball is also very low. Not included in these statistics are things like golf, tennis, things that just have pretty much an incidence of 0 when it comes to concussion. And then concussions are being diagnosed in greater numbers, which is something that people often wonder about. They think, is this sort of new fad diagnosis, if you will, that we're going to give everybody? I would say no, for a couple of reasons. One, we've got younger kids playing more competitive sports. There's kids that are not in middle school yet that are playing full pad football. So you're going to get more concussions because sports are becoming more violent and more aggressive at earlier ages. Also, we're recognizing these. It used to be, you hear the stories of the old football players who go, oh, I got hit and I went right back in. Now we're recognizing them. We're pulling kids out. We're saying, you don't get to go back to play until you've healed from this. So yes, they're being diagnosed in greater numbers, but I think that's an indicative of the fact that we're becoming more knowledgeable, and hopefully we're protecting our kids as opposed to putting these stipulations on them that makes it difficult to play. Okay, talked about symptoms. All right, so if you have a child who is playing sports and he gets his bell rung, which is a term that people who work in the field, the neuropsychologist that I was working under, did not like this term because she felt like it minimized what it was. But it's a term that you hear a lot, bell ring or something, I got dinged. So your kid gets his bell rung, his or her, and comes home and mentions it to you. What are you going to do now? One of the first things one of the most important things that they're realizing is that a child should not be sent back into practice or a game until he's checked out by a medical professional. They're coming up with new ways to do this. In Texas, if a high school athlete loses his helmet in a football game, he has to be pulled out for 3 plays before he's allowed to go back in. Some people feel like some of this stuff is sort of arbitrary and we're just making all these, silly little rules, but they're realizing the more research that they do, how important it is that kids get evaluated before they, the athletic trainer or the coach says, hey, you look fine, go back in. Another thing that is very important is to not rely on athlete symptom report. Some kids will be really honest and they'll come out and they'll say, I think something's wrong, I shouldn't go back in. That isn't always the case, and actually commonly, unfortunately, that is not the case. Athletes want to play. There's some social prowess that comes with being a good athlete. They don't want to let their teammates down. If their parents are putting pressure on them to play, they don't want their parents down. There's a lot of reasons for kids to not tell the truth about having a concussion or feeling like they're off or something's wrong. So that is definitely not the only source of information that you want to use to decide how to proceed. Also, along with kids may choose to not tell the truth, they also may not know the truth. If a kid suddenly has some blurriness in his vision, he may not automatically think, oh, I've got a concussion, I should say something to my trainer. The youth hockey players that they used for this study here were 12 to 15. So they weren't really young, but they should have had a little bit of exposure to what a concussion is. And 25 to 50% of them were not able to identify a symptom of concussion, which, headache, that's a pretty basic one. Most people know, oh, if I've got a headache and I got hit pretty hard, that may mean something's going on. And then there's a lot of reasons why they choose not to let a coach know. They're also finding out that there's differences between why female athletes don't report and male athletes don't report. Female athletes are more likely to downplay their symptoms, figure it's not a big deal. Male athletes, it's more of the social stigma that comes with being hurt, which sort of makes sense if you think about gender stereotypes. So I'm going to talk briefly about what happens inside of a brain that has suffered a concussion. Immediately after the athlete receives a blow, the brain becomes very excited and burns through the glucose that it stores. Well, it doesn't really store. The brain doesn't store a whole lot of energy, so it burns through the glucose that is available to it. And then it goes into this hypometabolic state where it's sort of struggling. It's like a body, it's like if you don't feed your body. You're going to feel that after a couple of days. So basically the brain has worked really, really hard to try and deal with this assault, and then it's struggling because it's depleted all of its energy stores. So in a number of steps, what it ends up doing is the brain loses its ability to regulate blood flow. So when you work out hard, you feel your heart pounding like in your neck, or if you're working out really hard, you can feel it pounding in your head. And that's where you're getting to the edge of your brain being able to regulate blood flow. And that's what's happening to a concussed athlete's brain all the time. Because the brain doesn't have the energy that it needs to function, it has a hard time regulating that. That's why you get a lot of headaches associated with concussion, is because there's just a lot of pressure up in the head. One thing that people don't realize is that physical exertion obviously raises the pressure in your head. Cognitive exertion does the same thing, which is why academic accommodations can be so important for an athlete who has, well, really any academic load, but particularly a difficult academic load. Academic accommodations can be really important because otherwise you're essentially forcing the brain to work on not a whole lot of energy if you're sending them back to school and expecting them to function normally. There's a lot of different systems, a lot of different ways people diagnose a concussion. You'll hear the grade 1, grade 2, grade 3 diagnostic system sometimes. There's not a whole lot of research to support any one diagnostic system, and it's not universal. There's a lot of different individuals who are involved in concussion diagnosis. There's trainers, there's doctors, there are neurosurgeons or neurologists sometimes. There's obviously neuropsychologists, and a lot of them have their own diagnostic system, but none of it's universal. So not a whole lot of weight gets put on diagnostic systems, but it can be helpful. You know, if you hear someone say, I had a grade 3 concussion, that's generally more serious than a grade 1 concussion, etc. One of the most important things about assessing a concussion is that hopefully it will involve more than just one person. Hopefully it will involve a medical doctor, a trainer, hopefully the coach is involved. I would argue that a neuropsychologist needs to be involved, but that's also what I'm trained to be, so obviously I have a little bit of bias towards that. But there's several different components, hopefully, to diagnosing a concussion. You want to see how the athlete is functioning neurocognitively. So how fast are they thinking? How well are they able to remember? A medical exam can be really important. Occasionally, like we saw, 900 athletes die from a TBI every year. So there's the possibility that a concussion could lead to bleeding on the brain or something more serious. So it's important to have a doctor involved. You want to ask the athlete how they're feeling, how they're experiencing their concussion, but then you also want to get collaboration from other people, their parents, their siblings, their friends, if it's a trainer, you know, who could ask around to other athletes at school. And then postural stability is something that's used where they'll have an athlete balance, you know, look at how will they balance on 1 foot versus 2 feet versus their eyes closed. Having multiple people involved in concussion assessment not only allows people to work sort of within their area of expertise and offer their opinion in the realm that they're most educated, but it also sort of helps to share the pressure. If this is, you know, the star running back who the coach really wants to get back, but you've got 3 medical professionals saying, no, this person shouldn't be playing, it sort of helps to share the pressure, which isn't the case in every situation, but can become an issue. I'm going to talk briefly about neurocognitive testing. Again, that's just where not expertise, but what I know, this is where it lies. And it's becoming a larger and larger part of concussion management. So neurocognitive testing looks at, like I said, how quickly the athlete can think, how well they can remember. Those are two of the main things. But it typically involves baseline testing. So it can be done, baseline testing can be done, there's computer tests, there's one that we're going to look at later that's just a paper and pencil test. And it's done before the season starts. The idea being that then you have a good record of how the athlete is functioning before their concussion. This is important for any athlete, but an athlete who, say, has ADHD or a reading disorder or something where their baseline is going to look a little bit different than your average athlete, this becomes significantly more important because then you have their functioning to compare their post-concussion functioning to, as opposed to trying to compare them to just the average athlete, which they probably look different. One of the areas of controversy in concussion testing is how soon after a concussion you should retest someone. The neuropsychologist that I trained with felt that they should be tested 24 to 48 hours after a concussion. The reason being, then we can offer academic accommodations. You know, if an athlete is really struggling with their verbal memory, well then let's make sure that they're not taking reading tests and they don't have 60 pages of social studies homework to read in the next week. Some people feel like they shouldn't be tested until they're completely asymptomatic. So their headache's gone, they're not having any dizziness, then retest them again in order to decide whether or not they should be sent back in. Those are the two sort of main schools of thought on it. Regardless, the most important thing is to not overtest them. We had an athlete come in to the clinic that I was working at, and he had a concussion. The trainer gave him a couple of days and then literally tested him every single day for the week following that, which at that point the test just sort of becomes useless because he's taken it so many times. And the computerized test that they were using uses different words that they have to memorize and different figures that they have to remember. So he wasn't seeing the exact same test over and over, but that would be probably considered poor practice regardless of whether you're talking to someone who says you need to wait till they're healed or you need to do it shortly after their concussion. All right, moving on to concussion management. These are the most important things that an athlete can have or do for themselves after they've had a concussion to help rehab. Physical rest is vital. They have to sleep. That's the only way the brain can heal itself. Mental rest, like I said, we talked about academic accommodations. Cognitive exertion is difficult. It's hard for the brain when it's recovering from a concussion. Sleep, so they shouldn't obviously be working out, but they also need to be able to sleep. That was something that we would see sometimes in the clinic. They would come in and they were laying on the couch all day, but they couldn't sleep and they weren't getting better. So they need to not only be physically resting, but they need to be sleeping. And then stress management. If you get an athlete who comes in and they're a 4.0 student and they're a high-achieving athlete, and you tell them, guess what, you can just sit in your house for the next week and not do anything, that tends to raise their anxiety levels. So any options for stress management that can be offered to these students is really important. One of the most important things is school. Athletes who've had a concussion may have difficulty remembering, they may have difficulty tracking the lecture, they may have difficulty taking notes because it gives them a headache, they may have difficulty studying because it gives them a headache. So providing academic accommodations is really important. I'm not as familiar in Missouri with how it works. In the concussion clinic I was working in Texas, the neuropsychologist would fill out an academic accommodations form, they would send it to the trainer would then go to the school nurse or the school counselor, and then the school counselor was the one who would facilitate that among the teachers. So that's something that should be a big focus, particularly for high school athletes who've had a concussion. athletes need to be completely asymptomatic before they start back to play. Some people feel that they can start back sooner, as long as they're not in physical contact, they can start back. Most of the research is saying that athletes need to be completely healed because you're just basically prolonging their recovery if you start them back, even if it's on non-contact exercise. And I put in links here for a couple of this is the Missouri State High School Activities Association. And they actually have a law in place that an athlete has to see a medical, no, I don't think it says medical, like a qualified something professional before they can go back in. Again, I'm not as familiar with how it works in Missouri because the concussion clinic I worked in was in Texas, not here. So I don't know how much that's enforced. But that is the state law. And that can be important, especially as a parent. You should know what's expected of the people who are taking care of your kids, because if you don't feel like it's up to snuff, then you should step in and do what you feel that needs to be done to help protect your child. So this is an example of a return to play protocol and how you decide when to return an athlete to play. So there's several different factors that should play into that. Obviously, if they're having symptoms, they shouldn't be starting back. If they're neuropsych or their neurocognitive data, they say they don't have any headaches, but all of a sudden they can't remember a whole lot, it's probably a sign that they're not ready to go back. So the concussion factors that they talk about, history of concussion, if the athlete has already had 2 concussions in the season, and the season is only 3 months long, you may want to wait a little bit longer before sending them back. And then obviously you've got the factors that come along with the individual player, if there's pressure from the family, pressure from friends, team factors, and then extraneous factors may or may not be an issue. Sometimes turf versus grass on a football field may make a difference on how soon you want to send back an athlete, but generally that's not that big of a deal. The point of the whole thing is that it's not like you do step A and then you do step B and then you do step C and then the athlete's fine and you send them back. Hopefully, there's a lot of people involved and there are a lot of things taken into consideration before you decide an athlete is ready to go back to play. All right. I said this before, but it's really important that an athlete with a concussion has a medical evaluation. There can be, generally there's not, but there can be bleeding on the brain. There may be, some other anomaly that is playing a role. Regardless, make sure the kid sees a doctor at some point. And then once they're asymptomatic, the trainer, the doctor, the neuropsychologist, everyone who's involved feels like they're ready to start back. Typically you want to return to play to be stepwise, so you build over the course of several days. This is just one example. It's a pretty general example, though, so it matches what most neuropsychologists use a stepwise return to play, what they use. You start with exercise and then build up, so eventually you're ready to send the athlete back into a game. Some of the important things, an athlete needs to remain asymptomatic. If they start doing physical exertion and all of a sudden their headaches come back, that's a good sign that they're not ready to proceed and they need to stop and wait until their symptoms subside. This can be the asymptomatic thing can be difficult, especially if an athlete has had to sit out for 3 weeks and then he or she thinks they get to start going back. It can be really important that the athletic trainer is pretty blunt and pointed in their questions, so that the athlete, has to say yes or no. I have a headache, because I'm sure it's hard to admit I don't think I'm ready to go back if the athlete really wants to go back. So this is a news story. This was done in Texas. Concussions are a big deal in Texas because they have football is such a big deal in Texas. And there was several news stories recently. And the neuropsychologist here is the one that I worked with, so that's why I had access to this news story. But if you'll have to click it with the... Okay. It's just a short little...
Welcome back. If your child suffered a concussion on the gridiron, would you be able to tell? These days, you might get help from technology that was once only available to professional athletes. Ted Hibbert has the story.
A concussion is a brain injury, usually caused by a shot to the head. It happens a lot in football. Here in Texas, 'tis the season for that. It was during a Friendswood Mustangs football practice that 15-year-old Cole Bloodworth, well, he looked like he only had 2 games, took the first hit. Gave him a headache, but he shrugged it off. The next practice, his bell got rung again.
I hit a kid head to head, and so I felt dizzy, and I couldn't really walk or anything after that.
Nicole's mom is a nurse, and even a few hours later, she could tell he wasn't himself.
He couldn't answer questions appropriately or quickly enough. It just took him a while to try and formulate what he wanted to say.
The coaches referred Cole to the Ironman Sports Medicine Institute at Memorial Hermann. He was evaluated by neuropsychologist Summer Ott of UT Health.
Athletes don't have a cast in their head after a concussion. They look very normal. And this test helps us see what's going on with the function of the brain.
The test flashes words and shapes on the screen, measuring recall and response time. Cole scored in the bottom 1%.
He performed very poorly in areas of reaction time and speed, much lower than would have been his estimated pre-injury level of functioning. So he's an above average student, and he was performing the impaired range in those areas.
And she explained that I was in the low percentile on 2 of them, and I wasn't very pleased with that, but I knew something was wrong.
Diagnosis, concussion. Prescription, no sports, no school, no fun.
I was at home in bed, basically, couldn't text, play video games, nothing.
But doing nothing was just what the doctor ordered. After 3 weeks, Cole Bloodworth's scores were back to normal.
We can get them back to play safely if we do it the right way.
And Cole,
Great, feels good to be back.
was back on the field. But concussions, if not managed, can cause permanent impairment. And you can't always count on your kid to level with you. Just ask Debbie Holiday.
They're not going to be honest with you all the time because they want to play.
So parents, know the signs: nausea, vomiting, confusion, double vision. For a full rundown, hit our website, check the Seen on TV page. I'm Ned Hibbert, Fox 26 News.
I think this is a good example of how it's becoming more, this is good. Like, this is the stuff that needs to be out there because parents watch the news and, they see something like this and it gives them, hopefully, at least sort of what's their appetite as to, what a concussion is and what they should do if they think their kid got hit. All right, so I put common in quotation marks because there really isn't a common recovery trajectory. Typically it's 7 to 21 days, but there are a lot of things that can affect that. They're finding that younger athletes actually recover slower than, high school athletes recover slower than college-age athletes, elementary-age athletes recover slower than high school-age athletes. So that makes a difference. If an athlete has like ADHD or dyslexia, premorbid headache or headaches that they had before the concussion, all those things for some reason slow down the recovery process of a headache. Female athletes actually recover slower than male athletes do, which we're not for sure why that is. Estrogen is actually a protective factor in concussions. But for some reason, it takes women longer to get back on their feet after they've had a concussion. The number of concussions that an athlete has had previously typically also will affect how long it takes them to recover. One thing that is important to know is that symptom recovery and neurocognitive recovery are two separate processes, and they typically happen at different rates. So an athlete may not have headaches, but they're still having difficulty thinking, or vice versa, although it usually doesn't happen that way. If they're having headaches, they're usually probably having trouble thinking as well, just because we have a more difficult time concentrating and attending when we're in pain. Research has shown that athletes who are still experiencing things like headache or light sensitivity 3 days after their concussion typically have a longer recovery. But again, that's typical, so that it's not set in stone. So effects of cumulative concussion is something that is a pretty popular topic, primarily because of all the stuff that's going on with the NFL and the brain donation that's happening at, I think it's Boston Medical School. The problem with the research that's being done with, say, a 45-year-old NFL player who was in the league for 10 years is, what does that mean for a 10-year-old who now has better equipment, and hopefully their concussions are being better managed than, a guy who is now 45 or 50 and played all of his football, in the 1950s, 1960s, 1970s. We don't know. So the best thing at this point that we can do is learning what a concussion is, how to manage it, and making sure that our kids are not playing when they're concussed. Some research has shown that having one concussion increases your rate of having another concussion, but there's other research that has shown that there isn't a difference. So again, more research just needs to be done on our little kid, or our younger athletes. Second impact syndrome is something that, for some reason, only seems to affect high school athletes. Once athletes are in college, there are actually no reported cases of college-age athletes having second impact syndrome. Second impact syndrome is when an athlete gets hurt, they go back into play too soon, and they get another concussion, and it can sometimes kill them. It causes pretty immediate and pretty massive swelling in the brain. So if they can't get to the hospital soon enough, it either causes long-term irreparable damage, or in some cases they will die from second impact syndrome. It's pretty rare. I think they've had 17 or 18 cases reported in the last decade, so it really doesn't happen a whole lot, but it is a possibility. So if anything, this should make parents, it seems like, all the more cautious about sending their kid back in, because that possibility is sitting out there. So we're going to talk about some myths. The first one is that a concussion only happens when an athlete loses consciousness or passes out. That isn't true. It's something that we hear a lot. It seems like we heard a lot from parents who would come in and they said, well, my kid didn't, he never lost consciousness. It doesn't matter, actually. On-field amnesia, so the trainer, as the athlete comes off the field, if the trainer says, what play did we just run, or what play were we, did we just call, and the athlete can't remember it, that is actually a better indicator of concussion than losing consciousnesses. Another myth is that concussion will show up on brain imaging. It's not uncommon for parents who take their kid to the ER because they think they've had a concussion to have a CT or an MRI, hopefully just a CT because an MRI is really expensive, ordered. A concussion won't show up. Sometimes, though, these can be important because this will pick up if there's a bleed on the brain. Brain imaging will pick up on that, and that can be really important. But 99% of the time, you'll have a clear CT. A lot of times it seems like people will come in and say, well, isn't a concussion like a bruise on the brain? Well, and I can see a concussion on my arm. Can't I see a concussion on my brain on one of these scans? And a concussion actually is not. A bruise is for blood pools under your skin. And your brain isn't actually bleeding. It's just not being able to utilize nutrients and nutrients as well as it's supposed to. So that's why you get that's what happens with the concussion, not actual bleeding on your brain. Another myth is that you have to get hit in your head to have a concussion. which isn't true. If I'm going to use another football example just because this is how they most commonly happen, but if an athlete is standing up and someone hits them either from behind or in front and they're not expecting it and their head either throws forward or throws backwards, you can still get a concussion through a mechanism like that, as well as, like head-to-head that is commonly thought of when someone says they have it or they received a concussion. Another myth is that kids recover quickly and they don't need to be treated. One of the most important reasons that it's important to have a kid examined by a medical professional is that if there is something more serious than a concussion, hopefully they will catch it. One of the things that we heard parents say was, "Oh, I didn't let my kids sleep the night after their concussion," or "I didn't give them medication the night after their concussion." If the kid goes to a doctor and the doctor says, there's not any bleeding, then the kid can go home and sleep. They can take medication, because that's the idea, is that if your kid is, has a hemorrhage in their head, you don't want to put them to sleep because they may not wake up. If you take them to a medical professional and the medical professional says your kid's clear, then take them home and put them to bed, because that's the best thing you can do for them. Like I said earlier, kids who are younger actually take longer. So this idea that, oh, it's a little kid, they'll just bounce back because, that's what little kids do. They fall down, they get up. It's actually not even less true with little kids than it is with high school kids. And then if they don't have a chance to rest, that will prolong recovery, typically. Another myth, and this sometimes happens when individuals who aren't as trained in concussion are managing athletes who've had a concussion. They'll just say, "Oh, just sit out for a week and then you can go back." And like we talked about I talked about when I was talking about recovery trajectories, there's a lot of things that should go into deciding whether a child is ready to return. And having this sort of blanket policy is just really ineffective, because you may have a kid who recovers in a couple days and does the return to play protocol and he's fine. And you may have someone who comes in with migraines, premorbid migraines, and it takes him 4 weeks to recover. And if you send him back 1 week afterwards, he's not going to be ready to go back, and then you've got issues of re-injury. So the blanket policy is generally not a good choice. And then the last one, sometimes I heard this a couple of times when I was looking at an athlete who had a couple of concussions. The parents would say, "Well, does he just need a different helmet? Like, I'll go buy a helmet for him." And unfortunately, there is not the helmet. Or kids who play soccer will wear the headgear, thinking that that's gonna save their brain. Equipment is important. It's really important, and it helps, but it is certainly not the end-all be-all for guarding against a concussion, unfortunately. So, some psychological implications of a concussion. Concussions can be difficult because if an athlete breaks his leg or he separates his shoulder, he's got all this nice covering on the outside, and it's really obvious that he should not be on the field playing in a game. Athletes who get a concussion don't have that luxury, unfortunately. They can look really fine and probably even act really normal if they're trying, and it may seem weird to their teammates or whatever that they're playing. So that sort of adds a whole other layer of injury, psychological implications of an injury. So obviously there's a whole range of reactions that you can have. Unfortunately with concussions, because stress and cognitive activity can actually prolong recovery. If you've got a kid who's really stressed and is just worked up all the time about the fact that he has a concussion, that can actually sort of make his symptoms worse. The nice thing is symptoms like depression or anger tend to resolve, and concussions don't take as long as like an ACL to rehab. So hopefully, after 2 or 3 weeks, if your kid gets rest and he's feeling better, these psychological symptoms, these emotional reactions to the injury, hopefully will see. One of the things that they found in research with athletes who have some sort of premorbid diagnosis, ADHD, dyslexia, migraine headaches, is that they may be even less willing to report symptoms, because there's already the stigma of, oh, I have a learning disorder. Awesome, now I'm also an athlete who can't play. You know, if the child struggles with their school and athletics is a place that they can excel, stepping away from that one place where they do really, really well can be hard. This is something that should be considered as they're recovering. When athletes think their injury is worse, obviously their psychological reactions are probably, or emotional reactions are probably going to be stronger. So that's one place where education about concussion is important. The fact that it won't take them 2 months to recover from this, most likely. That this is a transient thing, and the more they can stay calm and rest, the quicker they'll recover. Hopefully will help them calm down and reduce some of the anger and the strong emotional reactions to being hurt. Something that they found in football is this idea of playing scared. So the athlete is recovered, they're ready to go back, but they're scared they're going to get another concussion, so they play timidly. Particularly in football, can actually increase their chance for re-injury because they're more likely to get a bad hit or not see something coming. So it's important to make sure that the athlete is ready to return, not only physically and cognitively, but emotionally, that they're ready to go back out and play with the intensity that is necessary to be successful in football. Soccer is some of the same, but you know, if they get like a volleyball injury because they hit their head diving for a ball, that's got a little bit different implications than sports where they're going to have bodies running at them. So parenting, like I put the playing scared bullet up here again because that's something that parents can really, hopefully, if you've got a good relationship with your kid, be able to talk through them with and maybe help them sort of work through some of those fears. If your athlete isn't willing to initiate a conversation about, do I want to return to sports, then the parent should be the one to initiate it. Sometimes it's not worth it to an athlete, especially if they have aspirations of, you know, going to college, or if it's more important for them to not deal with the side effects of a concussion and the potential long-term implications of a concussion, then they may not want to go back, and that hopefully is something that parents will be okay and will be supportive of. Parents also need to be aware of the pressure that they put on their athlete. There's sort of many different realms that the parent can put pressure on from. One, unfortunately, that is not uncommon is parents cannot believe their child that they have a concussion, or not believe their child that they're having these symptoms, which was something that as a professional I had a hard time dealing with professionally, because, you know, if the athlete is willing to come forward and say, I have a headache, I don't feel good, and the parent's like, I don't really know if I believe you. It was just hard to be professional about that, but obviously, you know, that's what you have to do. But if an athlete is willing to come forward and say something's wrong, the parent hopefully should be the first person that is supportive of that. So I have, and I may actually just give this to you. So the sideline assessment of concussion it's actually just a paper and pencil test that an athletic trainer will do. And I'll just give this to you to look at so that you have an idea. Ideally, they would give them a baseline on this test. So it asks the athlete things like, what month is it, what day is it, really basic things, and then also gives them like a list of 5 words to remember, things that should be pretty basic and pretty easy at baseline, but sometimes can then become problematic after the athlete has had a concussion. Like I said, that's a paper and pencil option. The test that Dr. Ott was talking about on the news story is a computerized option that works in a similar manner, where you give the baseline before season, before hopefully the athlete has had any injuries, and then once they get a concussion, you test them again. I just wanted to offer an example of what concussion testing might look like. And then there are several different resources. These are the ones that I find particularly helpful. The CDC actually has a ton of information about concussions, and it's very, very user-friendly. So if you need more information, that is a great place to start. The moms team, this website here, is actually headed by a mom who had an athlete who had a concussion, and she felt like it wasn't managed properly. And so she has become a real advocate for getting education for parents out there so that they know what should be going on in proper concussion management. She's actually making a movie about a high school football team in Oklahoma, maybe. And they went in, and she got a lot of money because they went in and they gave them all new helmets. They taught them how to hit. Like, they totally revamped the way this football team worked because they had such a high rate of concussions. And she, her premise is that if you educate and you, teach people what they need to know, then you can decrease the rates. And so that's what her movie is about. And then this bottom resource is the sports medicine page for the Missouri High School Activities Association.